Infection control in the neonatal intensive care unit. The CDC and the WHO have developed specific policies and guidelines related to infection prevention in the neonatal intensive care unit. It is important that all nurses responsible for care of patients in these areas understand these guidelines and are able to implement them appropriately. In my 2 years of experience in the neonatal intensive care unit, I have had to learn and also help develop these policies and help exercise their implementation. Infection control is a critical aspect of safe patient care in any patient population, but it is even more important in the delicate neonatal population. Today we will focus on 3 particular aspects of infection control in the NICU: hand washing, standard precautions, and nosocomial infections. As stated by the CDC, hand washing is the #1 means for infection prevention available. Without doubt, it is the simplest and easiest way to prevent the spread of infection in any given population. El-Khafri et al. In their study stated, it is recognized that infection control, and in particular, optimal hand hygiene, decreases the frequency of hand contamination with potential nosocomial pathogens. Some long-term studies have also demonstrated a decrease in infection risk by sustained hand hygiene programs. Preterm neonates are a high-risk patient group for acquiring nosocomial infections, with the most preterm infants experiencing the highest rates of all hospitalized patients, resulting in significant morbidity and mortality. Okay, so here I listed it down. Proper hand hygiene techniques are very, very important. You need to use enough soap and water and wash your hands thoroughly for at least 15 seconds, making sure you cover your fingers, in particular your thumb and your wrists and the back of your hands. It will take you about as long to do this as it should take you to sing Happy Birthday. If your hands are not visibly soiled, you may use an alcohol-based cleansing solution. Put a quarter-size amount in the palm of your hand and rub it until your hands are dry, covering all surfaces of your hands. This should take approximately 20 to 30 seconds. There are 5 recommended moments of hand hygiene during patient care: before patient contact, before an aseptic task, after body fluid contact, after patient contact, and after contact with a patient's surroundings. Keeping hands clean will help protect your patients and ensure they are given safe patient care. In addition to hand hygiene, nurses should also be conscious to use appropriate standard precautions on all patients when caring for them. Standard precautions include the use of personal protective equipment when caring for a patient and knowing what type of equipment you need in which scenario. Gloves need to be worn when handling any patient body fluids, blood, or dealing with open wounds. When you remove the gloves, you need to wash your hands appropriately and use new gloves for each patient contact. Barrier precautions such as gowns, masks, and face shields are also a part of the personal protective equipment you will use. Gowns are used when there's a chance of any splashing or soiling to your clothes by body fluids, blood, or secretions. A mask, face shield, and protective eyewear should be used when there is a risk of body fluid secretions coming in contact with the mucous membranes of your eyes, nose, and mouth. Proper isolation precautions and transmission-based precautions need to be implemented correctly depending upon the diagnosis of the patient to prevent the spread of infection to other patients in the hospital, otherwise known as a nosocomial infection. In comprehensive neonatal nursing care, Carol Kenner and Judy Lott state that almost any organism, given the right environment and support, can become a nosocomally transmitted infection. They also quote Maldonado et al. That nursery epidemics can be caused by gram-negative and gram-positive or viral organisms because they have the ability to colonize or infect human skin or gastrointestinal tract, the ability to be carried from person to person by hand contact, and characteristics that allow existence on hands of personnel or in fluids or on inanimate objects, including intravenous fluids, respiratory support equipment, and solutions used for medications and disinfectants, and also banked breast milk. Once again, hand washing and standard precautions are very important to prevent the spread of these infections. Nurses who are caring for the patients should make sure that the patients have dedicated personal equipment or that the equipment is thoroughly cleaned between each patient. Infection control is a necessary part of patient care in the NICU setting. Nurses and other healthcare providers must be extremely careful and conscious when taking care of these delicate patients. Proper education is required. These little lives are at stake, and it is the job of those responsible for their care to ensure that everything possible is being done for their safety.